It goes right back to the beginning, if I was to be honest about it, knowing what I know now and looking back to from having birth trauma and the impact that that had, then to a lifelong issue of respiratory problems and breathing problems, to the point where I ended up getting my adenoids removed to try to help me breathe through my nose. So I am thankful for that. But my respiratory problems caused me to mouth breathe for many years. So I ended up with that, what I know now is a classic look of flattening of my cheekbones and a long face. I was class 3, which means that my jaw grew down and forward. So I had an underbite. And I didn't like the way this looked. I felt very self-conscious about this in high school, and the kids made fun of me. And all through the years, I had issues. I went to speech therapy because I lisped like crazy, still do somewhat. But when I was 17, I had surgery on my jaw where they broke it and they pushed it back about 7 millimeters.
Wow.
And, this moment for me was life-changing in the sense that it gave me my confidence aesthetically. I felt I looked better. I became a little bit more outgoing because I didn't have that underbite. But I started to have other issues. I started to wake up during the night gasping for air.
Yes.
I started to have issues with my weight and really struggle with my weight, which I never had issues with that growing up. I started to get very severe migraines. And over the years, it became more and more debilitating. When I got pregnant with my own children, I really, really struggled during those times. And so it wasn't until I was around 40 that after going through so many years of feeling like, what is wrong with me? Why don't I have the energy to go and work out and exercise like everybody else?
Yeah.
Why am I struggling so hard? It seemed like life was really hard. And I went for a sleep test. And in my doctor's defense, they had recommended a sleep test for me years before. But when he recommended a sleep test to me, all I heard was, he thinks I'm fat. He thinks I look like a middle-aged truck driver, because in my mind, that's what people with sleep apnea look like, right? Is a big belly and older, much older than I was. So I was like, there's no way I'm going for that sleep test. So it took a number of years for me to go.
Yes.
And when I went, they told me that out of the 7 hours that I reported sleeping, I only actually had 20 minutes of sleep.
Oh my goodness.
And I never got into a deep phase of sleep.
Right. How could you function? I don't know how you functioned like
that.
How
could I function? I know. And I didn't understand the implication, but it explained to me why life was so hard.
Right.
And so I think part of what motivates me now is that there was many checkpoints along the way where I interacted with healthcare professionals, and nobody picked up on the clues.
Yes.
When I said I was tired and out of energy and I just felt like I couldn't do what I needed to do, they, of course, assumed I was depressed and would send me to talk to a social worker or go for therapy or offer me medication.
There's a pill for an L.
I guess, but the thing is, when you're that tired, you feel numbed out. Have you ever had that experience where you're so tired, your brain feels numb? And so I really didn't want to be taking medication that would make me feel more numb. And I came to discover that you can go to all the therapy you want, but you can't talk yourself out of a physiological problem. So once that physiological problem is identified and you start to have the energy and the mental clarity, and you start to feel like you're coming back to being who you were meant to be, okay, then if I have issues, I can sit and talk about them. But so that's where now I'm motivated. I'm a registered nurse, like you mentioned, and I work in the emergency department. I did up until November. And we see so many patients coming through there all the time that before I would have just said, you're probably not making the best lifestyle choices, try to exercise more, eat better. I would have put the onus back onto the patient.
Yes.
You're doing something wrong. Now I look at them and I can see clearly written all over their face and evidence through their body that there's a physiological problem that we're missing. So I'm really passionate about helping healthcare providers to not miss those opportunities to notice what your patient's body is trying to tell you.
I'd like to talk about what some of those signs and symptoms look like, and because it helps highlight those things for all of the health care practitioners listening to this show. It helps parents, it helps loved ones of family members that are having these symptoms. We can fill in the gaps for that healthcare provider, because this day and time, a lot of people just have a few minutes with a healthcare provider. So it's easy to touch on. You've got so many topics you could touch on that could be affecting a given situation, and you have to highlight what you think the chief complaint is when you go into the doctor, because they might just be there for 5 minutes. And some of these things could take, honestly, many, many conversations to sort of peel back the layers to determine what the problem really is, what's the root of the problem. But like you said, until you can get down to that root and address it, all the cognitive behavioral therapy in the world might not really get you that good night's sleep, which might have been an underlying cause. So maybe we could start with touching on some of the healthcare, some of the health detrimental things that happen when you have bad sleep. Just in a nutshell.
Yeah, it's so hard to just there's no part of your body that doesn't suffer if you don't sleep well. So, but if we were to take the big ones, let's look at cardiovascular health. It's the number one killer in America. And I think I wrote down a quote that I wanted to share on here. So it's from the president of the American Heart Association. And he said that the burden of cardiovascular disease in North America is growing faster than our ability to combat it, and that it is going to get much worse in the coming years, and that preventative care is the key. So my nurse brain says to me, cardiovascular health, high blood pressure would probably be one of the most common evidences of that. When I speak to healthcare providers, it amazes me. Okay, I'm going to try to reserve judgment.
You're teaching us, remember?
Okay, why do we wait until a patient has high blood pressure that is unsuccessfully treated on 3 medications before we'll send them for a sleep test? Yes. Why is that the standard? Why don't we, when we see a patient's blood pressure starting to creep up, why don't we then start to look for reasons why and try to prevent that person from getting to a point where they are having cardiovascular damage, where they need blood pressure medication? It would seem to me that would be, a fantastic time to do home sleep test at the very least, right? So let's say we're going to save healthcare dollars, do a home sleep test. You get a baseline. And if you start to see there's some mild sleep apnea there, where do we know that mild sleep apnea is going to progress to over the next few years? It's going to get worse. So intervene now, open the airway now, make sure they get the oxygen that they need, and decrease that workload on the heart now. That's going to decrease your atrial fibrillation, your stroke risk, right?
Yes.
Definitely. So it impacts so much peripheral vascular disease. So, I mean, that is just one example, right? Then, of course, you can talk about endocrine, hormones, diabetes, all those other things. We could go on all day about the implication.
And then for children, you have ADHD and ADD, these diagnoses where kids are having trouble focusing in school. They may have a lot of allergies. They may have that dark pooling under their eyes. And we also see, dentally speaking, we don't see them growing. They have a narrow archway, maybe a flatter face, so their cheekbones don't appear as strong. And a lot of times we're seeing a correlation there with diet, soft diet, rather than, we feed them baby food instead of finger foods. We may not. We need to touch on a lot of these topics tonight in this hour that we have together. Also, just anyone out there can consider, if you're not getting a good night's sleep, I, for one, you don't want to really be around me the next day. I'm going to be a little bit irritable. And if you compound that day after day, year after year, that's going to take away a lot from your concentration abilities and how happy you feel.
Well, and so this is the thing, is that I know we're really advocating for everybody to get involved in this. But if you're in that sleep debt and you're in that state of mind, me trying to talk to you about the poor choices you're making about your sleep and your screen time and what color is your bedroom painted, because that might be a problem. What's the temperature? All those health hygiene things are fantastic for helping people to get sleep. But the studies show that if you are not getting at least 6 hours of sleep, you won't respond well to that type of an intervention. It doesn't work well for you.
Your executive functions are impaired.
Yes, yeah, exactly. And I just wanted to point out, when you were talking about pediatric, Dr. Christian Guilleminault, he made a point at one conference I was at where he said that the restoration of continuous nasal breathing, especially in children, is the ultimate goal for being able to successfully treat pediatric sleep apnea. So you're right, all these signs and symptoms you pointed out around here, this here is life-changing, being able to breathe through your nose.
Yes. See, if you don't get good sleep, heart disease is a big one. You could also have high blood pressure. All the symptoms of heart disease leading up to heart disease: chest pain, heart attack, irritability, but also even obsessive behaviors. And we touched on pediatrics with ADHD and ADD. And I think you had, when we were speaking earlier, some interesting statistics, Julia, about children in high school and starting school and how they're managing some of these problems because it's such a prevalent issue in today's society.
Yeah, you know, that's the thing, is that our poor children are so tired, and yet they have to go to school and function all day long with other kids. And that's a challenge at the best of times, let alone when you're overtired. Our society, as the parents go to work, the kids have to go to school. So what we're seeing is that when they become teenagers and have more of a right of determination over their will, if you will, the schools are really having trouble in the mornings getting kids to the classes. So the high school that my son goes to, they said that 30% of the kids don't make it to school before 10 o'clock in the morning.
30% of kids don't make it to school before 10 a.m. in high school.
Yes.
Wow.
Yes. So there's a movement out there called Start School Later. And these are a bunch of concerned moms who have gotten together, and they're really pressing for the start times for school for teenage years, where we know that they have that delayed phase kind of sleep. They go to bed later, they get up later.
That's that circadian rhythm thing.
Yes, yeah, it's physiological. It's not them just being lazy or don't want to go to bed. Their bodies are changing. And so that is one change that takes place. So they advocate for the schools to recognize the science, and behave in accordance with the science, which would mean you start school later so they don't miss out. So yeah, the more we become aware and the more we learn better, the more we have an opportunity to do better, especially for our young people.
That makes sense. What types of signs and symptoms can we talk about to just let the general public know, or healthcare practitioners know, what you're looking for? What do you see when you see a patient? You see their face, because I think you mentioned to me earlier, there's so many there's so much health information by just looking at someone's face.
Yeah, I mean, you can tell if their organs are overtaxed. You can tell thoughts. So one of the things we document in psych is does their affect, or does their face match their apparent mood? Does it match their speech, or is it incongruent? We can look at, for one thing, I teach the nurses I work with, if they don't want to listen to my whole spiel, I'm sure they get tired of listening to my spiel, is if you looked at the tongue, if there's a scalloped tongue, 89% of patients with a scalloped tongue have an obstructive sleep disorder. So that's huge. 15% of people with a sleep disorder don't actually snore. So we can't just trust, do you snore or you don't snore, right?
Yes.
That's not everybody's going to snore. But you're looking for, even you see like the big necks.
Yes.
So you're looking for lymphedema around the neck. Does the tongue look too big to be fitting in the jaw, the upper and lower jaws? If you look into the mouth, are the teeth crooked? Do they look like they don't fit? When you look up, does it look like the palate on top has room for the tongue to go up and rest against that palate? If it doesn't, there's a good chance that tongue is stuck in the back of the throat. So when that patient goes to sleep and everything relaxes, that tongue is going to relax into the back of the throat and crowd their airway.
Yes.
You know, we're looking at, is the face even? Is there asymmetry in the face? And how does that affect all the fluids and everything, all the flow that needs to take place while a person's sleeping, so that the neurological debris is washed out through the night while they're sleeping? Otherwise, you wake up with a brain fog, you start to have memory issues. And the
Yes.
studies show that leads to dementia or Alzheimer's down the road. And you could have seen these signs up to 20 years before the onset of Alzheimer's symptoms. So why are we waiting for people to get to this point?
We
You
could
know,
make
the
such a
minute
difference.
we can make a huge difference. And I want to retain my mind for as long as possible. I mean, we want to have a long life, but we want to have a good quality of life as we age. Mm-hmm. So all through the ages and stages of development, we have missed opportunities that we can go back now, knowing what we know, and have an opportunity to intervene all the way along.
My understanding is that the largest growth of the jaw and the face is between the ages after you've been born is between the ages of 2 and 4. So that's a prime time to get an excellent, like a hard diet in that helps broaden the jaws through the functioning of the jaw and the muscle. It's important to be aware of how a child is swallowing and if they're tongue-tied. Can they stick their tongue pretty far out? Can they get close to their nose when they try to touch their tongue with their nose? Can they put their tongue on the roof of their mouth? I'm not going to do it on here. But also looking at how they swallow. So there's a big difference between swallowing if the baby is nursing versus swallowing if the baby is bottle fed. And
there is.
let's talk about that a minute.
So you know something, and this is a tough subject for most moms. So let's say the mom can't breastfeed for whatever reason. How do we support that mother? If we know that breast is best, we know it's best for the milk, but we also know for jaw development, it's very important. And they are going to be switching to a bottle. Are there exercises that they can do to help that child? Can they stimulate the facial muscles? Can they use a device other than a soother? Is there different, how do we now, as healthcare professionals who understand the importance of craniofacial development and forward facial growth, how are we teaching our moms who are bottle feeding to help their child in order to prevent problems down the road? That's where, one of the things that really I hate to see moms doing is squeezing those fruit packages into their baby's mouth.
Yes.
Instead of just giving them an apple and letting them go to town, and exercising and mowing down on food to develop that. So yeah, from 2 to 4, you're looking at that facial height growing. You see that baby starts to lose the baby look and converts to looking like a kid now. And
that's true. They stretch out.
Right?
Mm-hmm.
So, and neurologically, the development that's taking place during that extension is massive. And what we see in an older adult, where here we'll be measuring developmental milestones, that as their neurological development grows, they develop skill after skill after skill.
Sure.
But in our senior years, or people who are starting to decline now with dementia, they lose those skills in the descending order. And we see a collapse of the cranium occurring. So maintaining that height, that cranial height, and with our through our teeth and our airway is the key actually to having healthy neurological development all through our lifespan.
I'd also like to talk about how you weren't done. I don't want to go ahead.
No, I wanted to ask you. What tips would you give to a mom who's struggling to breastfeed? Related to what might be happening with the tongue that might make it a challenge for them.
I would have the child evaluated maybe by their pediatrician or a dentist to see if they might be tongue-tied. That's one. That's one thing. Possibly a myofunctional therapist if they're not maybe not an infant, because if the tongue is not positioned, it really ought to be plastered sort of against the roof of the mouth, maybe a quarter of an inch or so behind where the upper incisors ought to erupt, the upper front teeth. And the tongue really shouldn't come much beyond that area in terms of speaking. In watching how that tongue pattern is going. Is the tongue lifted up towards the roof of the mouth, or is it down? Is it because that's going to be something that we might call a reverse swallow. And what we see physiologically is when that tongue is not, if it's too far forward, It seems to, in some ways, obstruct the airway. The child's posture changes. Their airway is decreased, and they actually go into more of a mild sympathetic overtone. Or let me explain this a little differently. It puts some of their cranial nerves in a position of overworking, and some of the other ones of not carrying their normal load. And the patient, that child, is always a little bit more anxious or a little bit more turned on. Their nervous system's always turned on a little bit more than they would be if they weren't in that position. They can't rest the same way.
And what's interesting, you can tell when they're sleeping if you just gently pull down their tongue, their lip. Sometimes you can see the tongue is sucked up to the roof of the mouth where it should be.
Yes.
When they're sleeping. But the other point I wanted to make about that is about mimicking the caregiver's expression.
Yes.
Because, what we see is from a child at birth, they're looking at their mom, and if you stick out your tongue to your baby's going to stick their tongue back out to you.
That's a good game.
They mimic facial expressions. It's fun, and
it
it's like when it happens,
game.
you're like, what? But over time, think about how much time they spend while they're in your arms watching your face. And if you're a mouth breather, they're going to copy that expression and that facial posture or oral rest posture, they call it. And so a mouth breather begets a mouth breather, So people say, oh, it's genetic. Right. My mom did the same thing. Yeah, I bet she did. So it's recognizing how we're impacting our own children. It's significant.
That's a very interesting concept. It makes you wonder about these things historically, like something that was called the Habsburg jaw, these other habits or genetic expressions. How much of that is what you were really born with, and how much of it was turned on by mimicry or lifestyle?
Yes, exactly. And I did want to touch on, too, with the nasal breathing in children, and I'm going through this with my own child, how, the anxiety piece that you mentioned, and, how the importance of breathing through the nose for the brain to function properly. And the minute that mouth pops open, it's as if you put a blindfold on the brain. It's not getting the sensory input that it needs. It's preparing to run, because when we're about to run, our mouth will pop open and we have that air hunger, and yet nothing's actually happening. And so these children, their bodies are in a stress state. And, I've gone through this with one of my children who was constantly, I always described him like his volume was on max. And, I called him my little Hulk, because you never knew when he was going to go off,
Right. They're either on or off, and they're on like an Energizer bunny, these children. And then when they crash, they shut down instantly, or they melt down. And they melt down at inappropriate ages and times, when they should have grown out of that.
Yes, because you figure by now, come on, pull it together. But I kept knowing what I know. I kept pushing for more appointments and more tests and more studies. It turns out that my son experienced birth trauma. He was a precipitous delivery. 10.5 pounds came out just bam.
Wow.
He broke his nose on the way out.
Oh, bless his little heart.
So the poor little guy, we always laughed that he was born kind of with this stink face on.
Yeah.
And now it turns out his septum, the cartilage on his septum is completely off the base of the bone. Wow. And it's occluding the left nares, his left nostril. So that means when he cycles his breathing through, anytime he goes to breathe in on the left side, the air can't get through, his mouth pops open, he mouth breathes. Well, not being able to breathe on the left side of your nostril means the right side of your brain is hypoxic. It's not getting enough air. And if the right side of your brain is your emotional control, well, no wonder the poor guy is an emotional roller coaster. So again, once you identify the physiological problem, now try to go back and erase from people's minds the behavioral judgment call that was made, the behavioral label that was put onto your child.
Excellent.
How do you erase that, and let your child start fresh? And how does, sorry.
I think talking to your child, I know one of my children, this led me on this path as well as a mother. She had to get her tonsils out at the age of 4. And the way we led up to that, she had had an accident at preschool, fell, after that, we noticed that she was snoring. We spoke about it with her pediatrician. This was more than 10 years ago. Things may be different now, hopefully. But the pediatrician said, oh, well, she may have broken her nose, but we don't even deal with that until they're teenagers. But I said, she's snoring all the time. I can hear her on the other side of the house. So if you are in this situation with your child in that place, I would recommend you videotape that, how they're sleeping. Show that to some of your healthcare providers. Make sure you're heard on that topic, because that is not normal. And now we know, back then her solution was to get her tonsils and adenoids out. And what you might see when you first done that as a parent, your child will grow. You'll have a very rapid growth spurt. They do feel better, but you might not have had to go that route. We've met practitioners in our circles, professional circles, that they found if they could help facilitate that nasal breathing, those tonsils in some cases actually resorb back. They shrink down. So the surgery was never needed in some of those cases. So it's something to think about.
Trying to get to the root of what is the foundation for forming our airway and our cranial facial system, so we can all have excellence.
That is excellent. Well, guess what? We have a caller. So we're about to get a random question. I'm ready. Hello, you're on the Whole Healing Radio Show.
Hello. I actually have a quick question. So as an adult, I actually do a lot of mouth breathing unconsciously. What's something that I can do to prevent me from doing that? And how's a way where I can treat it with, or get back to being healthier without doing that?
Well, there's a number of solutions that you can try. Some people actually try taking a little bit of like masking tape or sleep tape, and they'll tape their lips while they go to sleep. There's another exercise, I may be mispronouncing it, the Buteyko exercises, where maybe throughout the day, make a practice of trying to breathe in through your nose, hold it for a few seconds, exhale slowly through your nose, and then see if you can build up to holding your breath for up to 40 seconds between breaths. All breathing through your nose. It's a practice. When you're not breathing through your nose, you'll hold on to more. Actually, you'll have a deficiency in carbon dioxide. You're not getting enough oxygen to your tissues and dumping out carbon dioxide. So you have actually more plugged up nasal passages. And when you breathe through your nose, you're enhancing the oxygenation of your tissue. You'll actually open up your nasal passages, which sounds a little goofy, but just try it. It works. And I would recommend you try these exercises for about 5 minutes before you go to sleep, and tape your mouth. Julia, I bet you have some other amazing ideas.
So yeah, it's interesting because it's the chicken and the egg thing, right? People say my nose is always stuffy, so I breathe through my mouth. But when I mentioned before about when you breathe through your mouth, you're putting a blindfold on your brain, basically. Your brain will go to protect you by secreting a mucus. And so your nasal passageways will become more inflamed. And then you're forced to breathe through your mouth. So just like the caller, I'm a recovering mouth breather. And when I first started doing exercises, I actually joined a Life with Breath. There's a coach, Ed Harrell, who has a program. And I joined this program where it was a daily thing of working on it. And he'll walk you through different exercises, just like you talked about, with through the nose and hold and up. And I would be messaging him and saying, I'm freaking out. Like I felt panicky. I felt like I wasn't getting enough air. And it's not as easy as it sounds. And for me, I couldn't just go to bed and tape my mouth at that point. It took me about 3 months of doing these exercises and being aware of it through the day, taking a minute to actually close my lips, do the exercise several times throughout the day, become more mindful of it, that I started to notice my endurance and my energy. I remember having to run to a code in the hospital, and I ran the whole way with my mouth closed, and I arrived with plenty of energy to spare instead of huffing and puffing like I used to do.
Wow.
And so at that point, then, I started to try taping my mouth when I went to sleep, and it made a huge difference in how I woke up in the morning. So be patient with yourself. This has probably been a lifelong habit. It's going to take you time to overcome it. But as you improve in your ability to do it more and more, your body will naturally start to convert itself from being in an acidic fight or flight, cortisol, norepinephrine, all that stuff that's going on. It will switch to a more serotonin, dopamine, rest and digest state that you will feel better. You don't have to go out and actually try to get better. You will. Your body will function the way it's designed to function.
Beautifully
Wow.
stated.
That's really helpful. I really appreciate you guys telling me that.
Well, good luck with that.
Thank you so much.
Thank you.
Well, that was neat.
Oh, it's a challenge. It's a challenge.
It is
for
a
sure.
challenge.
And I'm constantly telling my the kids, my son and his friends, are yelling, "Shut your mouth! Shut your mouth! Shut your mouth!" And it's they laugh now, but they start to realize. They realize when they're doing it, they don't feel as well as they do when they actually close their mouth and feel calm. So, yeah, and it's funny. There was a teacher that reached out to me, and she's a special ed teacher. Mm-hmm. She noticed that the kids that ended up in special ed were all mouth breathers, and so she started doing investigation and looking into it. And, so try to do some collaboration with the teachers as well. Why couldn't you take 5 minutes to start your day and get everybody in the class to just breathe in, hold that breath, breathe out, hold it out. If you took a few minutes at the beginning of your day and the end of your day, the self-regulation those kids would experience would be life-changing.
That's a great idea.
And anytime the class started to get out of control, just have everybody sit down and do those breath exercises. Right?
It's like creating a timeout without anyone getting in trouble. It probably prevents a lot of people getting in trouble. With my same child that I used to have issues with, I found that if I took her aside and said, "Are you hungry, thirsty, need to use the bathroom, or are you just tired?" there was usually a yes to one of those. But it also was the taking out of that environment that was maybe hectic or causing anxiety and kind of resetting, taking a deep breath. That makes a big difference.
I wish that schools would have a choice that at recess time or on lunch break, I don't have to go out to the schoolyard and run around. What if I could go and have a nap? What if I could go to a quiet place and lay down? Like, I remember nap time in school. Why don't we offer children the opportunity to just take a break out and have a nap pod or something like that? Anyway.
I like that idea. What about we've talked about the signs and symptoms as a parent, or as an adult. If you look at yourself in the mirror, if you have a scalloped tongue, that's a sign of sleep apnea. If you say ah and you can't see that little thing that hangs down on the back of your throat, your uvula, that's a sign of sleep apnea, or enlarged tonsils. Fatigue. There's another little 5-question internet test you could go find for yourself called the Epworth Sleepiness Scale. That's a nice way to figure out if maybe you might be tired if you want to fall asleep in traffic, if you want to fall asleep when you just have a few minutes of your quiet time and you should have had a good night's sleep. All of these topics that end up with big impact on your overall health. What about sensory issues? How do you see children with sensory issues having any sort of correlation here with these topics we're talking about? Sensory issues and sleep, or not good airway?
Yep.
We were touching on it.
So I think that you mentioned a few things about just not having the coping skills, and everything's overwhelming. But again, it ties back to, how I tie it back into is the face, right? So if you look at the body as an organism that is completely blind unless it receives input from your eyes, your senses, right? Your eyes, your nose, your ears, your mouth, your sensation. It can only operate based on the input that's coming into it. But what if, as your craniofacial area develops, it develops askew or off, or the sensory input coming into it is not coming in a balanced manner?
Maybe from an accident or a trauma, a birth process.
So, yeah, but mouth breathing can do the same thing, right? Because the bones don't develop properly, everything starts to kind of morph because we don't have that forward going in supporting the tongue, and that's, yeah. So if it's off, that child's going to be off. And it used to be, you think back in the day, you see these old-fashioned movies, and they're like, "There's something not right with Jimmy. It's just not right," And if you,
That's so
but how do
awful.
they know that? They could see on the face. But if you ask kids to play, and you ask them to pretend to be like the president, well, they're going to stand up nice and tall, and they're going to have, the president stands tall and has good posture. And if you ask them to play somebody that's not intelligent, they're going to slouch right down, and they're going to make their face, go slack.
Right.
They're going to make their mouth open. Their tongue is going to come out a little bit. They instinctively know this is not right. It's not healthy, right?
You're thinking like Napoleon Dynamite or something.
I don't know. And then look at cartoons. When they draw cartoon characters,
sure,
what do they do to their face? So
they're distorted.
This is one of the ways I was able to reason with my children. That look at all these characters. When they want to act like they're being goofs, they do that because the body can't function optimally like that. So you look at some of the work that's being done with, and this is, again, in medicine, we love the huge contrast and the very dramatic issues, right? But if you look at somebody who has Down syndrome, for example, and historically they've always had sleep issues because they've got a short face. Their tongue always seemed to be too big for their mouth, which ended up they had cardiovascular issues. And yes, there's all genetic components and all that stuff.
Sure.
But the work that's being done in helping to develop the face forward and to open up that airway is minimizing all of those other health issues. So if it works like that in a dramatic manner on that population, cerebral palsy patients, again, looking at how can we correct that so their mouth isn't gaping open and developing that way. We can see that with our children, slight variations in the face we need to take notice of, and I see it all the time. And then how do you approach the parent to tell them that without offending them?
Excellent question.
Because, right?
Yeah.
We've all seen that Seinfeld where they went to go see the baby and it was an ugly baby, but everybody was booing and awing. You can't, because people think you're saying that there's something that's not beautiful about their child.
Right.
But the thing is, all children are beautiful if they develop and function optimally.
Right.
So,
and it's our job in healthcare to be able to talk about, be real about these issues.
Yes.
Let's touch. You were originally considering, or you were calling it rest ed, as in you're rested because you are educated on rest, which it's very clever. Yeah. I love plays on words.
Thank you.
I do. And we were talking about how do you address, you're a healthcare practitioner and you see something's not quite right, as the example was with Jemmy, and how you want to be very, very delicate. I think in dentistry we might be more used to those types of things. I think that oftentimes you can be creative about how you address sensitive topics with your patients without being offensive. So we've been bleaching teeth now for a quarter of a century in every dental practice around at least the United States. And rather than say, you might want to consider bleaching your teeth, because that says a lot of things to a lot of people. We would simply initially ask on an intake form, do you like how your teeth look? That sometimes is a gentle way to open up a door to a conversation about aesthetics. There's a lot of other ways, but that's a very gentle way. So maybe... What do you suggest when you start talking about facial symmetry with children and parents?
So I can't really say, do you like the way your face looks, or do you like the way your kid's face looks? Because people take it, they won't get the message. They're already in protective mode.
Yeah.
And in society, we are trained to look at a face and assign an attribute of attractiveness or unattractiveness.
But we see symmetry as attractive.
Symmetry is attractive because it's functioning well. And so this is the thing. In the healthcare field, we've divided up the body into, you're going to focus on the heart, you're going to focus on the brain, you're going to focus. We've divided it up. And at the end of our training, instead of becoming more broadly knowledge-based, we specialize and we become more narrow-focused. So who is looking at the face as a whole? I mean, and I'm not talking plastic surgery to mask the underlying structural problems. There's a reason why in medicine, doctors have to do a face-to-face evaluation.
Yes.
Why? Why can't we just call somebody and talk over the phone? Because as human beings, we should be able to identify so much information coming to us from simply looking at the patient in a face-to-face conversation. Mm-hmm. But we are missing the things that the body is trying to tell us that the patient may not even be aware of. So I think it's important for every healthcare provider. It doesn't matter if you're a neurosurgeon, if you're a massage therapist. You're dealing with people, you're dealing with the body. Become an expert in craniofacial anatomy and how it works, how it communicates. It's face to the brain to the heart, to the gut.
Yes.
That is how we work neurologically, right? So that you have people who are paralyzed from the neck down. All they have is their face and their facial expression. But that's powerful. That's all they need to be able to communicate with other people, right? So the face is such a hugely important part of our body and our anatomy, and yet we're being blinded by societal norms about face and makeup and all that kind of stuff. So what I usually do is start by educating people. Did you know that one of the things that we are beginning to learn is that facial asymmetry matters? Do you think it would matter or people would pay attention to a child who had scoliosis of their spine?
What that does to the organs internally.
Yes, we freak out when we see that spine curving. We're worried about the lungs, we're worried about the kidneys, we're worried about all these things, and to the point where they will take kids and do a surgery and put a rod in there to straighten out that spine. Mm-hmm. So yes, to protect the organs underlying that spine. So now think about the face. This craniofacial structure, what is the underlying organs that need to be protected? Well, one is our brainstem and cranial nerves, but right down the center of that is our airway. And our airway is our portal to our health. So everything that goes in here, from what you eat, your nutrition, your diet, your ability to chew your food properly, your ability to swallow that food properly, that's important. But more important is the ability to get the air that from here, outside, in through your nose, in through your mouth, and down into your lungs, where it can do the job it needs to do. But for some reason in medicine, we've just said, here, dental, take this.
That's ours. Y'all don't touch that.
You deal with that. You deal with that. So that's, yeah.
So in a lot of dental practices, it's expanding where dentists are doing sleep apnea appliances. We can do things to help enhance the development of an airway, open up an airway for people that are diagnosed with severe sleep apnea, but who don't or cannot wear a CPAP machine very easily. There's trends changing in orthodontics where we don't do extractions to move slide teeth or shove teeth into the position where they might look the best, because now we're appreciating that there's a reason it might not look the best. If we don't look at the reason, you're going to be looking at orthodontic relapse and another set of braces in a few more years. And you really haven't health-wise truly helped the patient. And your aesthetic job here, it's not going to hold up. So
I hear lots of times people saying they've had braces 2-3 times and they're still having issues. And I'm not saying that when I was 17 I shouldn't have had surgery. Maybe I should have. But probably I should not have pushed this back. I should have pulled this forward.
I see.
Because then I would have had a really huge open airway. It would have so
you'll also have more room
instead of back.
You'll also have more room in bringing things forward for all these cranial nerves that connect, like the vagus nerve. It's the 10th cranial nerve. It connects all the way down. It's what makes you feel nauseous. I mean, it goes all the way down. It automates. It tells your heart to beat, tells you to breathe. When those things are crimped, these nerves, it really does affect your whole body, your whole health.
Everything. Yes. Yeah, so that's what I would encourage healthcare providers to do is, take some time and focus on learning the craniofacial anatomy the nervous system. And actually, Lois Laney, which is where I met you, does a
Yes.
fantastic job of bringing it all together and explaining how the nerves work and how we coordinate with the airway. And it's fabulous. So it's not like it's difficult to do or to find those courses, but you have to apply yourself to learn it, and then have the courage to bring the subject up with your client.
You do some teaching as well. You're teaching for AOSH, American Association for Oral Systemic Health, in November. You do a lot of lecturing. So you teach about cranial nerves as well, don't you?
Yeah, so I teach a functional airway and craniofacial exam. It's the same acronym as my name, but basically looking at the function of the airway. So my background is nursing, so I always revert to my experiences. But for example, when a patient has a stroke, we're taught to look for the drooping of the face, slurring of the words, the tongue not working properly, and weakness, right? That's, again, an extreme case. We are not taught to look for this melting of the face that occurs slowly over time, and what implications that might have, even though you see it on these very famous celebrities who have these degenerative neurological disorders. Look at their face. You will see marked asymmetry. And if you look back through the years, you saw it when they were a teenager.
Yes.
But it just looked like a cute, crooked little smile back then. But what has it become, right? And then if you look at the fact that when we have a patient that comes in with a stroke, we don't let them eat or drink anything because we know they can't protect their airway. Yet we let them go to sleep at night with an unprotected airway, thereby increasing the risk of having yet another stroke. So there's many areas of the healthcare field that we need to readdress.
Yes.
How we manage these, because airway has not been part of the equation up till now. So it is changing, and we're going to have lots of dates we're posting on our website at the end of the month.
And your website is? Tell us your website.
FAIHMuniversity.org.
FAIHMuniversity.org for Julia Worrall, RN and Executive Director of FACE.